Hey guys, it's Woody the Unexceptional Gamer, and this is Mail Monday, a weekly series that's not so much about the gameplay, but instead is about your questions and my answers to them. Let's get started. When I was 12, I was mugged by 3 guys, and ever since I have had little to no confidence. When someone laughs, I automatically think it's aimed at me. I'm sick and tired of this, and I was wondering if you could help. I even joined your live stream, and didn't have the confidence or nerve to talk. Thanks, Woody. Keep up the good work. So, about 3 weeks ago on Painkiller Already, I made the comparison between the post-traumatic stress disorder that a guy gets after being mugged or beaten to that a woman would get after being raped. And it was indelicate. I apologize for that. I was widely misquoted as saying that women are built for rape, which isn't true. I've been painted as being pro-rape, which is crazy and ludicrous and insane and redundant. But this kind of ties into the point that I was kind of making, that the guys suffer terribly, when they're beaten, when they're mugged, when these things happen, with a post-traumatic stress disorder that is similar to that a woman would get. It was kind of defending guys' rights. It was never meant to be condoning rape. And just to wrap up that topic a little bit, it was one commentator in particular, Faceless, who didn't misquote me, but instead kind of said, you know what? People look up to you, and they might view rape with like a lighter heart. It is not the terrible thing that it really is, because you're making light of it. And it kind of opened my eyes to the idea that, like, hey, when you talk about baby cooking, everybody knows, that this is a goof, and when you talk about rape, people might not. So anyway, that's where that was. I'm sorry, she made a really good point and opened my eyes in a way that, like, the misquoters didn't. But back to this guy. He's 12, or he was 12 when he was mugged, and now he's super struggling with who he is, and it invades his mind that it's impacted who he is as a guy. And to me, it's not a small thing. Like, I suffered from post-traumatic stress disorder in a way after my house was robbed, and while it didn't impact me the same way in terms of lack of confidence, it did in terms of fear. I had it was horrible for me to think that I wasn't safe in my own home. That was the big impact. Wow, look at this. For you, I think you shouldn't have to go at this alone, right? I think you should tell your parents that you're having a hard time dealing with this, and you like to seek counseling. I think, you said you were 12 when this happened. I'm going to assume that you're not older than, 17, 18 or so. And you need to know that you're not expected to deal with this all on your own. You're not expected to be able to solve all these problems without any help. I think it's completely reasonable to ask your parents if you can get some help brought in, if they can, set you up with a therapist of some sort and get together. There's no problem with that. Like, that's what I would do for my own kid. Heck, my own kid wouldn't have to ask about it. We'd be like, look, you need to, this is not a small thing. This is impacting you. I see the change in you. You're going to get some help. That's just how this goes down. And, a lot of guys wish they were adopted by me and etc. But my own kids, I think they view me just like like a lot of you view your own parents, in that, I'm not this, super wise, all-knowing, like, great guy. Instead, I'm just somebody's dad in the same way that you look at your own dad. And it's nice to have an outside look at how things are going, if you can swing that. I do think that it's worth telling you that, this wasn't at all your fault, and this isn't how most people are. If it's in fact impacted you on your daily life, then it really shouldn't. Like, this is something that you need to know isn't, going to be an everyday thing. This isn't going to be, this shouldn't impact, like, how you walk down the halls at school. And if you ever get in my live stream again, please talk to me. I'd be more than happy to talk to you back, and I generally try to be a nice guy. So I wish you the best, but it sounds to me like you could use some counseling, and like you deserve some counseling, and I'm on your side. I hope that you pull through this. And this how people react to like this post-traumatic stress disorder, right? Like how people act to some traumatic event doesn't necessarily define who they are. Like a lot of these military guys are just absolute heroes, beasts on the battlefield, and then it doesn't hit them until they go home. That to me is there's no cowardness in reflecting upon something and having it impact your psyche. You're okay by me. You just need to talk this through and understand your own value and keep your chin up, man. You'll be okay. So me and my girlfriend of almost 2 years are going to be having sex together soon. We're both virgins, and we've been wondering what kind of contraception is the most effective. We'll definitely be using condoms, but we'd like to have another form in there as well. I'm not sure we'll be able to get her the pill, but we're thinking of getting a spermicide. I just wanted to know if you have any better thoughts or opinions on the matter. Any help would be greatly appreciated. By the way, we're both over the legal age of consent, and as I've said, we've been dating for almost 2 years. It's not like we're some 14-year-olds trying to get it on. All right, I'm going to assume that your problem with the pill is that it's not over-the-counter medication. And shucks, I never know what's said globally, but like just in case in Finland, over-the-counter isn't a term they use. It means you can't just go to the drugstore and pick it up. You need to have a doctor's prescription, and it needs to be just for you. So the problem that I'm assuming is that you don't. It's not easy for you to go to the doctor and set all this up, which means we're limited to things that you can buy on the shelf. All right. First of all, the reason I pick this is that I get a fair amount of Mail Mondays about teen pregnancy, right? And if I can take a bite out of teen pregnancy, if I can reduce it even just a tiny bit, then this is a good use of our time. Condom's really going to be the answer here. That's what you want to do. And if you wear it properly, then you're in good shape. There are a lot of YouTube videos about how to wear a condom, and the big problem people make with these things is they put them on too tight. When you wear a pair of gloves that's a little too big, and while it fits your hand fine, you can sort of squeeze the end of your fingertip and you don't get any finger in there. That's what you want, right? That's how you wear this thing. You need to make sure that that it doesn't fit on completely like a glove, and that over the very tip of your penis here, there has to be a little bit of wiggle room. If you look at the condom itself, there's a little reservoir. So long as the thing is not insanely tight, it's not going to break and you're not going to get pregnant. That's the core of it. If you're looking to double up in some way, the spermicide gel that you mentioned is a good pick. Another good thing is the sponge. Either of those sort of double with the condom and make it wickedly effective, and there you have it. Some of those things can have downsides. Like I know the sponge in particular can make women more susceptible to yeast infections and urinary tract infections, whereas usually with condoms these things are not as big a problem. But yeah, if you wear a condom properly, you're in pretty good shape, and I applaud you for taking birth control pretty seriously, because it sounds like it sounds like, and I don't know you, so I hate to endorse it too much, like you guys are kind of ready to have sex and do this right for your first time, but you're not ready to have babies yet. And if that's the case, then you're doing it right. So yeah. Hey Woody, don't care if I'm on Mail Monday. I just want to know how to prep for surgery. I've never done it before, and I'm getting a metal bar in my chest because it's caving in. I just want to know how not to be so nervous and scared. Thanks. I've had surgery before. And being a patient is really easy. There's nothing to it. Here's how this goes down. First, you show up early in the morning, and they're going to change you out of your street clothes into some like sterile surgical gown or something. And you got to be rocking that gamertag swag to make the gown sexy, but I'm betting you can pull it off. The next thing is they're going to give you an IV line. And this is actually the only painful pre-surgery part of it. It's a needle. It's not that bad. You get it usually right in the crook of your arm, like opposite your elbow. And they'll drop an IV in there, or possibly on the top of your hand. Either one of those places are not particularly sensitive. It's not like it's in your palm or your fingertip or anything that would really suck. And you get an IV. And then the rest of the medication that they give you is going to be administered into the IV itself, which means no pain, right? And by that, I don't mean a little pain. I mean, they literally stick it in the bag or in the line that goes from the bag to your thing. So obviously you can't feel needles that are not stuck in your body. They stick it in the line instead, and you're good to go. So yeah, that's how this works. And then I'll keep going on the details. So you wake up, you change clothes, they give you an IV. From that IV, they can give you other medications. Like oftentimes they'll give you something to sort of calm you down. And when they do that, oh my gosh, that is a glorious, glorious thing. Like I remember when I had my ACL surgery, they gave me something. They're like, this will just make you a little calmer. You know, it'll ease your nerves. And I'm like, all right, let's see what you got here. And I just started going on and on about how much I love my wife and my kids and how they had to do an extra good job and because I needed to care for them. And you know, while these are thoughts I have all the time, they're not things that I say all the time. And I was just loopy and happy and all was right with the world. So, so that is probably what you can expect too. They're going to give you something to sort of calm you down and make you feel better, and it is going to be drugs, essentially. Drugs that make you really, really happy. While you're on, I don't know what to call it, the happy sauce, you're going to be wheeled into, right? They have these beds, a gurney that wheels you into the operating room, and you'll slide onto another bed, and then you'll be there. Now, this room is kind of scary. It doesn't hurt, but it's scary. They'll have like really powerful lighting above you, and there'll probably be a handful of doctors, like as many as 6, getting ready to do their thing on you. So so that it's awkward to get that much attention, but that's how this goes down. And from there, they'll put something else in your IV, and in my case, they usually asked me to count backwards, because I've done this a bunch of times, and they'll say count backwards from 100. You'll be lucky to make it to 97, right? You'll be 100, 99, 98, you're done. And that's how you get ready for surgery. The thing about surgery is it's not really anything that you're doing. It's kind of like saying you're nervous about watching a movie. You know what? You're not the one performing here. All you need to do is sort of chill out, relax, and do your thing, and you'll be all right. That's what your role is in this thing. So yeah, you know, I get that you're nervous and you're scared, but you'll be okay. When you wake up, you'll be in a recovery room. There'll be tons of nurses doting on you and giving you all the love and attention that you need. Your parents will be there quickly, you know, probably right after you wake up. They'll give you heated blankets and stuff like that. And then you'll go on to the process of recovery. I wish you the best of luck, man. Alright, if you guys liked the video, click on like. If you're new around here, you can click on subscribe in the top right. 2 videos you may have missed. The top one is some Infected gameplay. Infected is a brand new game mode released in Modern Warfare 3, and I've been having a good time with it. The bottom one are specs, like specifications on the Infected game type. Which classes go up against which classes, how the initials change to something different after they get their first kill. I explain how Infected works in detail, and I honestly think it's the best video of its kind on YouTube if you're interested in that new game type. Surprise video on the right, links in the description to t-shirt, Facebook and Twitter, all sorts of drama lately, and have a good day.